If you take amlodipine for your blood pressure, you might know it by its brand name, Norvasc, then I want you to listen closely for the next few minutes, because some of the things you've been quietly blaming on just getting older may not be old age at all. They may be coming from your blood pressure pill. Amlodipine is one of the most prescribed medicines in the entire country. Millions of people over 60 take it every single day, and for very good reason. Keeping your blood pressure under control is one of the most powerful things you can do to protect your heart, your kidneys, and your brain. So let me be absolutely clear before I say one more word. Nothing in this video is a reason to stop taking your medication. Please hear that. Stopping a blood pressure pill on your own can be genuinely dangerous. It can send your pressure spiking right back up. This video is about something completely different. It's about recognizing 6 common side effects that seniors so often mistake for normal aging, so that you can walk into your doctor's office and have a smarter conversation. Because here's the good news you'll hear again and again today. Most of these are things your doctor can fix with a simple adjustment, but only if they know it's happening. Everything I tell you is backed by the official drug information and trusted sources like the Mayo Clinic, and the links are in the description so you can check it for yourself. This is education, not personal medical advice. And stay with me all the way to the end, because the number one side effect on this list is the one almost everybody blames on their age or panics over as a heart problem, when very often it's simply the pill. Now, before we count them down, let me give you the one idea that makes all 6 make sense, and it's the reason this medicine works in the first place. Amlodipine belongs to a family of drugs called calcium channel blockers. In plain English, it relaxes and gently widens your blood vessels, so blood flows through them more easily and your pressure comes down. That widening of your blood vessels is exactly what protects your heart. But it is also the hidden reason behind most of the side effects you're about to hear. Just remember those 2 words, widened blood vessels, and every one of these 6 will click into place. Let's count them down. Number 6, flushing. That sudden feeling of warmth or your face going red and hot for no clear reason. You're sitting quietly, and out of nowhere, your cheeks feel like they're glowing. A lot of folks chalk it up to the room being warm or just having one of those moments. But think back to those 2 words, widened blood vessels. When the small vessels near the surface of your skin open up, more warm blood rushes close to the surface and you feel that flush. It's usually harmless, and it often settles down after you've been on the medicine a while. But if it's bothering you, it's worth mentioning, because sometimes it's a clue about your dose. That's number 6. Number 5, unusual tiredness, feeling worn out or low on energy in a way that isn't like you. This one is sneaky, because tiredness is the easiest thing in the world to blame on age. I'm just getting older. I slow down in the afternoons. And sometimes that's all it is. But when your blood pressure comes down, especially when you first start the medicine or after a dose increase, some people feel a noticeable drop in their energy. The fix is often simple, a tweak in timing or dose. So don't just resign yourself to feeling flat. Tell your doctor and let them decide. That's number 5. Number 4, swollen, tender, or overgrown gums. This is the one almost nobody connects to a blood pressure pill, so when the dentist points it out, people assume it's just their brushing or their age. But calcium channel blockers like amlodipine are a known cause of the gums swelling or growing over the teeth. The good news is that good dental care helps a lot, and your doctor and dentist together can sort it out. So if your gums have changed and you can't explain why, mention that you take amlodipine. That's number 4. Number 3, a fluttering, pounding, or racing heartbeat, what doctors call palpitations. You feel your heart flutter or thump in your chest, and naturally it's frightening. So people either panic or they wave it off as my age, my nerves. Here's the connection. When the medicine widens your blood vessels and your pressure dips, your heart can briefly speed up to compensate, a kind of reflex. Now, let me be careful here because this is important. A new or pounding or irregular heartbeat is always something you should get checked, because there are other causes too. So this is not one to ignore and not one to panic over. It's one to bring to your doctor. That's number 3. Number 2, dizziness or lightheadedness, especially when you stand up. You rise from your chair or get out of bed and the room sways for a second. This one gets blamed on age constantly. I just got up too fast. But for someone on a blood pressure medicine, this matters more than almost anything else on this list. And here's why. Dizziness leads to falls, and a serious fall is one of the biggest threats to staying independent as we get older. The mechanism is simple. Your pressure is lower, so when you stand, there's a brief moment before your body catches up. The smart move is to rise slowly, in stages, but absolutely tell your doctor, because if it's happening a lot, your dose may need a look. That's number 2. And that brings us to number 1. The side effect almost everyone mistakes for aging or fears as a heart problem. Number 1. Swelling in your ankles, your feet, and your lower legs. You look down at the end of the day and your ankles are puffy. Your socks leave deep marks. Your shoes feel tight. And the first thing most people think is, this is just what getting older looks like. Or they get frightened that it's their heart failing. Now here is what so few people know and why this sits at number 1. This kind of swelling is the single most common and most recognized side effect of amlodipine. Remember those 2 words, widened blood vessels. Well, when the vessels in your legs open up, a little fluid can seep out into the surrounding tissue, and it pools at the lowest point, your ankles and feet. And here's the part that genuinely matters. Because people assume it's their heart, they sometimes get put on a water pill to drain it. But this particular kind of swelling often doesn't respond well to water pills because it isn't extra fluid in the body, it's the medication's effect. What usually does help is a change your doctor can make, adjusting the dose or pairing it with a different blood pressure medicine that balances it out. So if your ankles are swelling, please don't just accept it as age, and please don't stop your pill on your own. Take a photo and show your doctor, and say the word amlodipine. That one conversation can change everything. That is the number 1 side effect. So let's bring it together. Flushing, unusual tiredness, swollen gums, a fluttering heartbeat, dizziness when you stand, and swollen ankles and feet. 6 side effects. And notice how easy every single one is to wave away as just getting older, when it may be something your doctor can actually fix. So here's what I want you to do. And what I do not want you to do. Do not stop your medication, and do not change your dose on your own. Amlodipine is protecting you, and stopping it suddenly is dangerous. Instead, if anything on this list sounded like you, write it down and bring it to your next appointment, or call and ask for one. Say what you're feeling, and say that you take amlodipine. You are not complaining. You are giving your doctor the information they need to make your treatment better. If this helped you, or you're thinking of someone right now who takes a blood pressure pill, do 2 quick things. Share it with them and subscribe. Because everything we make here is about helping you stay healthy, sharp, and independent for as long as possible. Take good care of yourself, and I'll see you in the next one.